Hello, hello. Hello,
Hi.
everyone. Welcome back to my YouTube video channel again. I'm honored and excited and really uh, humble to invite again my guest speaker, Dr. Richard Dow. We have at least 3 or 4 series already in different topic of dentistry. And today, I'm inviting him back to focus on one of the things that most of the young dentists and even 20-year dentist practicing like me, whenever we have some kind of invention or some kind of idea in dentistry, and we fade away quickly because we have no support, we have no mentor, we have no advice, we have nothing, nobody really help us to really like push us to the envelope and say, hey, you know what, you can do it. You can, somebody can help you. There's a system out there can help you to get what you want. For example, like let's say you trying to establish a product that you like to have in dentistry. You have the idea, but you stuck behind because your idea, as soon as you have the idea, you think it's work, but then after a few days, after a few weeks later, you gave up because you feel like this is overwhelmed, and you see a lot of people accomplish a lot of things, but you you shy away because you feel like there's no support, there's no advice. So the reason I brought Dr. Dow is because he is the inventor of multiple different product and dental organization and dental device on sleep medicine, oral care, a lot of different things, and he's been doing it for more than 50 years. So with a lot of information that he had done in his throughout his life, I'm honored to invite Dr. Dow to just share and each some of the basic concept how we get there. But before I do that, I just want to say hello to Dr. Dow. Dr. Dow, welcome to the show again.
Thank you, Locke. I appreciate that. Thank you for the introduction. Yeah, I've been around a while. I'm retired out of dentistry now, so I spend most of my time helping with the development of new products for OraCare, and also a new company that I'm starting for nasal rinses to help with different types of nasal breathing issues. So
Mhm.
those are things that I'm doing now. Uh, Yeah, I haven't updated that for a while. Actually, I have a diplomate in the ASBA as well, the American Sleep and Breathing Academy, so probably should fix that. So that's fine. Yeah, the oral care products is a company that I started with three other people, I mean, two other people, co-founders. So I'm a co-founder of oral care products. Um, I had the original idea for the company and the product that I wanted to use. And I think one of the keys that made that company work was the fact that it was presented to a group of high-end uh, dentists. Actually, the Platinum Circle of Fortune Management. I'm a member of the Platinum Circle of Fortune Management. I presented it as an opportunity and sought investment. So then, when that happened, we got a couple of major investors who are our co-founders, Dr. Martino, Dr. Bob Martino, and Dr. Burj Kalajian. Um, he's a prosthodontist. Bob is a owner of a multiple numbers of companies, and he's CEO of OraCare right now. Without Bob Martino, we would not be in existence. I think that's another key. So there's two things that I think are paramount about this company. One is that we sold our stock to dentists and they became our immediate customers as well. In other words, they had a vested interest in buying the product. So we had an immediate um, clients who were purchasing the product in large quantities. That's a key. You don't see that often. Your investors are also your clients. They're the ones that are buying from you. So that keeps the revenue going while the investors have their investment and they have a vested interest in making sure that it stays going. That's a very key issue. The other thing I had was a very expert advice from people in the Platinum Circle that helped me organize the business structure, like Steve Hardick, who is the CEO of Zoom Essence. These people had tremendous experience in business and could put together the circular memorandum for the investment. And then last of all, I had a person to run the company, Dr. Martino, who has vast experience. He has an aviation repair company. He has eight clinics in West Virginia that he manages, and he has multiple other companies that he manages. He's a brilliant business mind. I'm not a business mind at all. I do the science, and even then I have to consult with experts because I know just enough chemistry to be dangerous.
Yeah.
Okay, so those three elements. Then the last thing I have to say and give credit to is that when I got home from giving a lecture to the Platinum Circle in 2012 and they asked me what I wanted to lecture on, I said on bad breath. So I did it. And they laughed because I was going to lecture on bad breath. But when I got done with the lecture, the whole room was enthusiastic about what we were going to do. They saw the science. They saw that this product was extremely unusual and effective, something that wasn't even really aware on the market. Matter of fact, there's substitutes out there that call themselves chlorine dioxide, which really are not. They claim to be chlorine dioxide, but they are not. So we were able to position ourselves in the market, and we only market to professionals, and so that's also helpful. But really, this thing fell in my lap. I believe my Lord set it before me and made it successful. I don't think without that it would have gone anywhere. So I need to say that.
I really appreciate your the insight. But before we go deeper, I want to know, like, let's say if somebody a young dentist or a seasonal dentist, like having some kind of idea in making the product, what is the first step that he or she should thinking about, or should I try to work on myself to investigate that product first before I talk to someone else, or what is the
Sure.
first step?
Yeah, you have to investigate to make sure the product is going to work. Like right now, I'm working with some Princeton scientists on a new toothpaste, and this toothpaste is totally unique. It's going to be the first really different toothpaste in 75 years.
Wow.
It removes 90% of plaque, as most commercial paste, Crest, Colgate, and the rest of them remove probably 35 to 30%. So this toothpaste does that, but then it also does at non-prescriptive strength fluoride at 0.24%, which is what most people have in their toothpaste over the counter. It actually puts enough mineral into the teeth to actually outperform ClinPro and prescription strength fluorides. So when the testers for this product found that, and they were an independent testing company, they wanted to immediately invest. Now, what I can say to you, Locke, is that a lot of people, there's a lot of good ideas out there. Companies that make things that are really, really, really important. They all fail. Many of them fail. Most of them fail, as a matter of fact. They just fail because they don't get the right people in the right positions. Like they don't set up a company like we did, where your investors are also your customers. That's one thing. They don't have experts set up the investing and investment circular memorandum. They don't have. They have to get people excited and sold. So I sold to a few people who bought my idea, were able to invest, and then I guess that would be the way I'd do it. But you're right. most products fail, and they're good products. They just fail because they don't know how to do it. And I don't know how to say, I can't say that my way of doing it was the only way. I'm just saying that that's what I see. This company that we're looking at now with the toothpaste, they're making the same mistake. I'll tell you another thing that they make mistakes doing is there are people out there making all kinds of products. They got 10 or 12 different products in their head and they're doing all at the same time. You can't do that. You do one product, and then you run that product until it's profitable. If it takes 10 to 12 years, which is done with OraCare, that's what's happened.
Yeah.
And then you can start moving into some other product and maybe another product. But I had 100 products in my head. I still have 100 products that I know that I could make. But you can't do that. And that's what people like me like to do. That's what creative minds like to do. And they're fallacies because they can't do that. It won't work.
You have to focus. You have to focus on one and
one product and run it down to the ground. Okay.
Yes.
Really, really important. And you select your audience too.
Mm-hmm.
You do not want to market to a B2B and B2C at the same time. What I mean by a business to business or business to customer, you need to pick one. Trying to do both is a pretty good recipe. Most of the time, it's going to be a failure. Okay.
Okay. So either one to focus on one clientele that you hoping to do business with. Don't go both way, right? You're saying that.
I would, yeah. Yes, right.
And so would it be like the whenever we deal with like chemical or whether it's organic chemistry and things like that, does it involve with the FDA and the ADA?
Very good. We've tried to intentionally make our products cosmetic so they don't need FDA approval. But I'm making 2 nasal rinses right now. And even though they're cosmetic, we're still clearing it to the FDA. You need to be careful, especially when you do a rinse in the mouth or the nose or on the skin, anything that's applied to the body. You need to be careful. You get in trouble. So it's not like an FDA approval or cleared device, but you want to make sure you're not stepping out of line with the FDA. Okay. So I do intentionally make cosmetic products now. Now that we're successful and the company's doing well, and it's doing very well, by the way, we're opening in another 7 countries now. We're going to be real big, but now we're experimenting with a change to our rinse or an addition to our rinse, which would allow us to apply for FDA 510K approval. Now, that's interesting because we have the money and the time and the luxury of profits to move forward with, we think, a revolutionary way to do the rinse that's based on the same technology as that new toothpaste I told you about. That is going to be pretty amazing because if that is approved, we believe that we will completely dominate the chlorhexidine market. We target chlorhexidine now, but we believe that we can push them out. Okay.
When you mentioned about like 5K, 10K, FDA, what does that mean?
Well, FDA, going for an FDA approval is very expensive, millions of dollars. Okay. But a 510K, you take the technology of an already approved device and apply it to another device. And then you can transfer that approval if it's close enough to the old FDA approval and get approval for the new device at a much lower cost and much quicker. Okay. And the 510K, it's not chemical, it's more of a mechanical issue that we're doing with that. So I can't really go into the details because it's confidential information.
Right.
Yeah.
So regarding to those, first thing you have to get patency too, correct?
No, no patents either.
No, no,
No,
no need
no
patent.
patents. No.
Mm,
Uh-uh.
mm,
We have um we have intellectual property for this rinse, but people have tried to duplicate and are unable to. It's not an easy one to do. And they also don't know how to market it. So we're not concerned about that. We just don't care. We feel that we can out market and outsell anyone that comes into our space. That's fine with us. I mean, competition is going to happen no matter what.
mhm,
Um, and sometimes when you write a patent, you tell your competitors what to do. They can go read it, get the details, and then begin to find a way around it. If you could take an example, um, Nikolai Tesla um, actually went around the patent that Thomas Edison had on the light bulb and was able to put, redesign the light bulb in such a way with certain bells and whistles around it to get around a patent within a couple of years, and then light up the World's Fair at the Chicago World's Fair with his light bulbs. So I don't know. I'm not. I mean, patents have some value, but they're not something that I would rely on as a have to situation. Okay.
mm, mhm.
Okay.
It's wonderful. Now I want to go deeper in the oral care product. Do you have any material that you can talk about this, or I can share some slide? Because
Mm,
I know that some dentists out there haven't really have a chance to use the oral care solution,
mm,
and it's
yeah.
actually an incredible product that with the presentation that
Yeah.
your representative did that in on the webinar.
Well, we didn't really prepare for that, but I could show you some slides that I have if you
Sure,
want me to
sure,
share my
sure.
screen.
Yes, yes, yeah. You
Oh,
can
all
share
right.
now. Yeah.
All right. Let's just take a look here. I'll see if I can find them for you. I
Mhm,
think it's pretty quick here.
mhm.
You'll see a lot of clutter here. I'll get this out of the way and we'll go to uh, my Google Docs area here. That's a calendar. Let me just get this out of the way here. Oh, here we go. And let me see, this drive is out of date. Well, like I said, I wasn't prepared for this, but
Yeah.
I have this in here right here. Let me
Mhm.
just go to the slides. Um, and I have that presentation on nitric oxide. I think I sent that to you, Vok, on nitric oxide. And I don't know if you've seen it yet, but
You can actually present to us any of the exciting things, but like I said, I feel like a lot of dentists, periodontists need to know about oral care and how
yeah,
effective it
yeah.
is.
All right. So let's talk a little bit about OraCare, and I'll go through some of the latest material here.
Mhm.
Let's try this one. Um, I'm going to scroll down through here because I don't want to go through all these slides. There's way too many,
Mhm.
but let's just scroll down here. So chlorine
Yeah,
dioxide,
yeah, and then you can hit the shares. Yeah, share. Yep.
yeah.
Mhm.
Okay. So um, it's been used for many years in different industries. The military used it for field decontamination of water, cleaning wounds. Veterinarians use it on hot spots on animal skin, dental cleanings, and ear infections. City waters are also using it instead of chlorine for cleaning some water in about 1,000 communities throughout the world. Um, and then you can see that it's the best available technology for the control of Legionella, and hikers use it These are just some of the places they've been using it also for cleaning vegetables before they sell them to you in the
Really?
stores. Okay.
Mm.
And then the problem is you got biofilm and multifactorial causes of oral diseases. And so, you have the immune responses, the genetics, the incapacitated patients that need to have some treatment done. And we're thinking mainly of nursing homes here.
Mm-hmm.
And then you have poor antimicrobials and toxic antimicrobials like chlorhexidine. We also have a wide therapeutic index. That means that the dose between therapeutic, which is very low, and the toxic index, which is very high, there's a large gap there. So that's very safe to use. Okay.
Mm.
It also kills viruses and toxins and yeast that are not being addressed by other products on the market. And then we talk about nursing homes. Sleeping in dentures doubles the risk of pneumonia and the elderly. So we can actually address that with not only our rinse, but also the nasal rinses that I'm developing.
Mm.
We kill bacteria, viruses, fungi, and also Bscs. You don't know how important that is in the control of gum disease. And it also regulates the immune response. And it's good because it actually penetrates biofilm. We know that a single bacteria by itself is easy to kill, but in a biofilm, it's difficult. So you want something that penetrates it. Chlorhexidine really doesn't do much with the biofilm. Okay.
Mm.
So we're going to move forward. Actually, chlorine dioxide is a gas. It has this formula, ClO2.
Mm-hmm.
It dissolves easily in water, but it gases out over time. That's why when you mix the two, when we have it, we don't sell it to you already mixed.
Mm-hmm.
We sell it to you in 2 bottles. So when you mix the two together, there's this chemical reaction that takes place and it releases this gas.
Mm-hmm.
And so over time, that gas will actually gas out of the liquid. So, I mean, once you mix it, after about 30 seconds, it's activated well enough to use it at a good concentration. And then over the next 4 hours, it gases out and then it's pretty much worthless after that. It is a free radical, just like hydrogen peroxide, bleach, ozone, and hydroxy radicals, and it kills microbes, but it tends to be kind to the tissues. It denatures protein that's how it kills. And it has one of the highest oxidation capacities. In other words, it actually has a higher oxidation capacity than ozone does. It has an oxidation potential of 0.95 and 1.58. Now, I'll explain that to you in a minute. How could it have 2 oxidation capacity or powers? And that's because it exists in more than one state in liquid. So here it is. You can see here the oxidant power, and over here the capacity, okay? And over here you see the hydroxy radical has a very high strength.
Mm-hmm.
Okay, it's 2.8. Ozone, second on this list at 2.07. Hydrogen peroxide, 1.78. Hypochlorous acid, which is HOCl, you see a lot of popularity for that right now, and it's a good product, 1.49. And you can see they strip away 2 electrons, each one of these do.
Mm.
But chlorine dioxide will actually strip away 5 electrons, or 2.5 times as many electrons. But then it does have different oxidation potentials. If it's in chlorine dioxide state, that gas state is 0.95. But it also exists in liquid in an HClO or chlorous acid state. And that has an oxidation capacity of 1.58, which is actually higher than hypochlorous acid. And then it also is existing in a sodium chloride salt. And this is where most companies like Closis and OxyFresh are.
Mm.
Sodium chlorides, and they have a 0.7 oxidation capacity or strength. So we actually exist in all 3 states. We also have hypochlorous acid in our liquid. So In the liquid, we actually have 4 of these,
Mm.
and one of them is 1.49. I should put it down here in there. And so it'd be 0.95, 1.49, 1.58, and 0.7. Okay.
Can you explain radical oxidation potential? What does that mean?
Means it's power of oxidation.
Mm-hmm.
Okay. How it like when you cut an apple and you leave it open to the room that and turns brown, that's oxidation taking place.
So
Okay.
this is just lower. That means that it's more stable.
What it means if it's lower is it's not as powerful.
Mm-hmm.
So it's less powerful killer. So you can see one of the most powerful killers is ozone, but that's not always necessarily a good thing, because you put this in your mouth, ozone reacts with all kinds of things in your mouth that you don't want it to react with. What you want it to react with is just the bacteria.
Got
Okay?
it. Got it.
Does
Got
it
it.
make sense? And hydrogen peroxide does the same, although it's not very good on fungi. So sometimes you get black hairy tongue if you use this over and over again, where the fungi overgrows in the mouth. You don't see that with hypochlorous acid or chlorine dioxide. Okay.
That's very important because
Yeah.
so your product is at the lowest radical oxidation potential, so the lowest risk in the mouth.
It's low here, higher here, low here.
Right.
Okay. It actually exists in all 3 forms and also this form.
Mm.
These are very kind to the tissue, very effective, and they won't allow fungi overgrowth, and they won't react to things that you don't want them reacting with. When you do that, this loses power. Like, for instance, in sewage treatment plants, they can treat it with ozone, but they have to use a lot of it. Whereas with chlorine dioxide, they can use less because it has this capacity. Plus, it doesn't react with things it's not supposed to react with. It's selective. Okay.
Very nice. Very, very amazing.
So, and then we talked about active chlorine dioxide versus stabilized chlorine dioxide. That's the sodium chlorite that I told you about with the Closis and Oxyfresh and TheraBreath, things of that nature. Those are all sodium chlorite. They claim to be chlorine dioxide, and they're not.
Mm.
And then you can see that stabilized chlorine dioxide is just a salt, but you can activate that with an acid to produce chlorine dioxide.
Mm-hmm.
All right, and I'm going to show you something else here. This is a 2-bottle set right there.
Yeah.
A bad picture, but that's one of them. You ask about reactive oxygen species and what they do. They can have anti-cancer function, antibacterial, antiviral, and antifungal function. They're often produced by ATP, and they have some gene stimulation and function for the nuclear factor, erythroid factor 2, and they oxidize NADH to NAD, which is used to make ATP, and glucose 6-phosphate dehydrogenase is also affected in this equation. So can you see the top of the screen on that one? But this is the some of the references for antioxidants that you might want to read. Okay. So I'm going to scoop through here, and I can show you that this is a rinse, a study that we did at the University of Iowa, and we had our rinse at 14 parts per million compared to chlorhexidine at 1,200 parts per million, and we had very good results. As a matter of fact, our rinse, there's a couple of here, but our rinse was very, very good at dilution ratios of 1 to 32 and 1 to 2. As a matter of fact, on Agarigatorbacter, we actually had a extremely good dilution factor compared to chlorhexidine, as you can see.
Right.
We actually could, could kill it at 1:32 ratio, whereas chlorhexidine took 1:8. Now, some of these were very close to the same, okay? But we had a very good favorable outcome. And now, but what chlorhexidine won't do is attack the Bscs. So these, by the way, Dr. Venous, who did the study, independent of me, I had no input other than helping him interpret some of the things of how to use the product. Other than that, he said that it seems likely that the rinse is acting in an antibacterial cycle because they did a 24-hour minimum inhibitory concentration study. In other words, these are after 24 hours of submersion of the bacteria in the rinse, okay, after 24 hours. Well, we know this stays active for 24 hours. This one only stays active for maybe 4 hours, you see. So we know it gases out. As a matter of fact, within about 2 or 3 minutes, you don't have much use of it anymore. So this was doing the work that this was doing in much less time, very fast. And this is more inhibitory, whereas this is more killing. Okay. So those are some of the conclusions of Dr. Venous. And the next slide shows the pH of our rinse. And over time, it's at 4.5. It remains at 4.5. We did some studies on, well, actually literature reviews on pH of mouth rinses. And Listerine was at 3.87, which is lower than ours. Tom's of Maine was at 3.0 at natural rinse, okay? And those are much lower pH than ours. And yet the only rinse that showed any slight enamel etching was Listerine, and it did it at 17 hours. In other words, you submerge an extracted tooth in Listerine for 17 hours before you even see the beginning of an etching, and there's no saliva or washing of the rinse. So the idea that you have enamel dissolution from a 60-second rinse is ridiculously low. As a matter of fact, it doesn't happen. Okay. All right. So these are some of the pathways of Bscs that I've put into a. I'm not going to bore you with it. But these Bscs, like hydrogen sulfide and methyl, are just, these are very, very, I would say, stinky breath. In other words, that's a barnyard and that's a rotten egg smell. That's a barnyard smell. And those are what actually cause inflamed gums in your mouth. And they also inhibit wound healing. Matter of fact, they increase the membrane permeability and they modulate the function of fibroblasts. Bscs, they are actually sulfur compounds that react to DNA and proteins. They penetrate deeply into the tissues. They allow LPS to enter the tissues, leucopolysaccharides. And at least 83 bacteria produce this hydrogen sulfide. Another 25 produce dimethylmercaptan. Okay. And then you can see the more effects that they have. These VSCs induce 8-time increase in mitosis. They cause venous stasis. In other words, the blood slows down and the swollen tissue around your gums. They actually, mitosis requires more nutrients, but that's prevented by the venous stasis. The results in gingival epithelial necrosis and ulceration, and also induces the production of interleukin-1b from monocytes. So these reactions also release prostaglandin E2 and matrix metalloproteinase 1, which is a collagen destroyer of your gums. By the way, when the white cells that come in to fight the bacteria do that fight, they actually deposit their viruses in the gum, and then you get a viral infection. So you need something else to fight the viruses, and chlorine dioxide will do that. Okay. So I'm going to not go into much further into this because I could go on quite long and it would be very difficult for you. Okay, for your time span. All right, so I'm going to stop my share. Does that help you a little bit?
Yeah, so basically, yeah, you can stop it.
Yeah, okay, I'm going to hit share, stop share here.
So basically, your product is basically at I understand is it kill because the combination of chlorine dioxide and xylitol is also help antifungal, antivirus, and
Yes,
perioinflammatitis, help
yes,
to heal the gum and gingivitis. I know that I watched the other video presentation that the other doctors show that the patient had a very severe gingivitis, and after he used it for 6 weeks, no dental prophylaxis or
yeah,
anything, but just using that straight, so
all right,
improved like amazing.
yeah. Well, you know, I'm a principal in the company, so uh, I'm I have a financial interest in what I say, and I also can't tell you that any of this that I've mentioned is FDA approved. I have to make sure that you understand that, and
Mhm,
your listeners understand that we don't make medical claims. Okay,
mhm, mhm.
okay.
Yep. It's just wonderful. Just the idea overall that how the reason I brought you in is because, like I said, some of us, a lot of young generation, we seen those people like you been there, done these product, and we just want to learn from you how if you have an idea in order to pursue your dream, the step that need to be involved. What are those steps that you can summarize? Like, what are the steps that you should do to
Mm.
really obtain your desire to come up with the product or the
Well,
device?
you need to speak to an influential group,
Mm,
present your idea. Preferably, the group will also be your customers.
mm,
And then you need to, once there's interest, you have to use your group to find the experts within that group or recommendations from the members of that group to run the company. Um, you don't want to let the scientist who invented the product run the company. Okay, that's what I'd say.
And then I noted that sometimes, like when we do these things, it costs our time, it costs money, and sometimes it fail. And can you share with us, like I'm sure throughout your years of developing this product, there were certain time like you almost want to give it up, or when you almost like say, you know what, it's not worth it. I'd rather just do dentistry, those thoughts in your mind, and then you overcome it. And can you share a little bit some of the
Mhm.
story that you probably did run into those?
Well, I've never felt like I wanted to give up on this company.
Mm,
Um, but I can tell you that it was touch and go. We hired the wrong CEO.
mm,
We didn't hire the wrong, we hired a CEO when we first started that wasn't, he was good for putting into place our relationships with labs and artwork, but he wasn't the person that we could keep. So after about a year and a half, 2 years, we replaced him with Dr. Martino. So you have to be careful because if your CEO is not getting the results you want, you need to do something quickly. That would have sunk us right away. The second thing that happened was the production of this rinse is extremely difficult. This is a really hard rinse to make, very, very technically tough. And you need to understand as a science in chemistry that a lab formulation in a small batch is completely different from the chemistry in a large production. They're really, really different.
very
They
different.
don't translate. They do not translate well. So you have to be careful with that. We had a batch early in our system that we made, and they were very expensive. We're looking at $200,000 batch of product that almost wasn't going to make it, and we would have lost that. We would have lost that amount of money starting out, which would have been devastating. But we were able to fix it and make it sure that it worked and get it out as a usable product. But the lab almost ruined a $200,000 purchase, and that's very scary. Okay.
Mm-hmm.
Yeah.
So when you said you chose a CEO and you realize that his role and his ability to build a company after the initial stage, uh, is it easy to let him go? Did you have a contract
No,
with?
that was a difficult process. We offered him stock options that he could purchase at a very low price. No, that was a very uncomfortable thing because I really liked the man, still do.
Mm-hmm.
But it just wasn't right for the job, and there are hard decisions that have to be made sometimes. You just, I guess I'd say, you have to surround yourself with a good board, a board that gives you advice. I was taking a leadership role early in the company, and the faster I gave that up, the better, because I'm not very good at letting people go.
Mm-hmm.
But it has to be done if you're going to save the company sometimes.
Right, right.
Yeah, very, very important that, I mean, and he's an amazing person, really, really amazing. So it's nothing but best that I wish for them. Okay.
Also, I just want to touch up on some of the sleep appliance that you develop as well. That's also a little bit different than the chemical, the solution in the people mouth, because now you're dealing with the device. So is it harder or easier in terms of developing and put out on the market? How would you compare the two product, the solution
But
product, and the device product?
if you're going to develop, like there's a gal in Washington who developed a floss that's biodegradable.
Yeah.
It's a great idea. But she has to get to the right people. And we have people bring us products now because we're successful. People bring us products. We had a periodontist in California introduce a product for cleaning between the teeth, and we looked at it. We didn't think it was innovative enough, and it was too expensive, and we rejected it. That is difficult because there were people that really wanted us, even in our own board, who wanted us to have that product in our offerings, but we said no. And I agreed with Dr. Martino that it was a no. I wish these people the best, but sometimes people's products aren't as good as they think they are. And that was true of the periodontist. The floss is pretty good, but you have to think about, I mean, all the time, Dr. Martino is telling me that might be true and it would be, but it isn't going to sell. And he talks about the bell curve. This is the product you want to sell, not something here or here on either side of that bell curve. That's a small market. He markets to the large market, and his words in his marketing is always to the large market. It's not where I would go as a scientist. I'm always intrigued by the science and the this and that. And he's always telling me no. And he's right. Almost all the time he's right. Okay. So I don't know how to do that. Somebody who develops another oral sleep appliance, I would think they should take them to a person like Gergen Lab, down in Arizona. Somebody who does that sort of thing, who is smart about it, knows how to get it going. Okay. Or a group that's already established in the sleep industry that is got great people in it. and you get them involved in what you're doing, they could become investors and buyers of your product. That's what I would do if I were them. Okay.
Good. I think you just a couple last thought about you mentioned you recently obtained the diplomatic of the sleep and
Uh,
in academy. Would you explain how is that impact and what your uh, ability to diagnose and help people? A lot of us, the young dentists, we don't know. We need your information, advice.
in 2020, just before that, actually it was 2019, I was looking online at a product called Bongo RX. It was in Canada. Bongo RX is a prescription nasal device that you wear on your nose. Looks like this. This is the Bongo RX. Okay. And it fits in the nose like so.
Mm.
Okay. And it has a valve. And when you breathe in, there's no resistance. When you breathe out, there's resistance. So it stents open the throat and just like a CPAP would do, stenting, because it creates positive pressure when you blow out. Your lips have to be sealed when you do that. So if you're a mouth breather, this won't work for you. But the Bongo X is a good product. I was looking for the person to sell it and bring it to my patients. I ended up being referred to a nurse practitioner in Oregon, in Portland. His name is Joseph Selk, and he's the best friend that a dentist ever had. He's also developed oral sleep appliances that are patented and FDA approved. He's worked with thousands and thousands of sleep patients, and so he refers patients to dentists, especially Dr. Skinner up in Portland, who does the Portland Protocol. I have never seen an organization that is more well run and more comprehensive than Air Institute in Portland, Oregon. They are amazing. And they teach not only oral sleep appliances, but they actually teach that at the end. They want dentists to start out with Bongo RX and the Excite-OSA and the INAP and arch expansion, nasal expansion, MSE, all these things, Nightless, to increase patient airway without the use of an oral appliance, and then maybe bring the oral appliance at the end. Most dentists are taught, they go to a course and they learn about oral appliances, and they get a very poor, in my opinion, education. What I like about the American Sleep and Breathing Academy is you see that doesn't say dentist in it, does it? There's no dentist in that name. It is any kind of healthcare professional who works with airway and sleep apnea issues. Okay. So I like the concept of the program, and you learn from physicians and other healthcare providers that you don't. And the reason I like it is because I train chiropractors in sleep medicine, and I want them to eventually be a part of the ASBA, although they're not part of it right now. Eventually, I'd like to see them become part of that. Okay.
Yesterday, I was treating a patient who have a posterior, anterior open bite and a very large tongue. He using the sleep CPAP machine, and his tongue getting bigger and bigger every year when I see him. Is there anything that you would suggest him to be someone to be seen?
How old is he?
About 50, 55, something like that.
Does he have narrow arches?
He, I would say average.
So if he has an open bite, you
Mhm.
can have him treated by, I don't know how close he is to you, but Dr. Terry Coddington,
Mhm.
who actually intrudes posterior teeth with TADs,
Mhm.
and also uses Invisalign to intrude teeth. What that does is when you intrude the upper teeth, the jaw auto rotates forward. Okay, closes the bite. And of course, he does some movement of the upper anterior teeth and lower anterior teeth too. But it is very innovative. They also expand the arches to accommodate the tongue. And when you expand the arches, especially with MSE, you can actually widen the space in the nose. because the palate and the nose are the same. So you can open airway in the mouth and the nose at the same time. There's
So,
always an uprighting of teeth that takes place with the Invisalign. Yeah,
Dr. Dow, are you saying that let's say that patient was a younger patient, um, closing the anterior open by intruding the upper posterior teeth would definitely going to improve the sleep issue?
I believe so, because the jaw being back, it will be brought forward. It'll open the airway in that manner, but you're also at the same time widening the palate at the same time. So you're opening airway because you're creating more room for the tongue, as well as in some cases, probably not in a 50-year-old, you can increase nasal airway space as well, especially with MSE. You can actually separate the suture on a 50-year-old, even a 74-year-old like me, if you do some laser punches at the same time.
Wow, that's good to know. Dr. Dow, what the reason why the tongue getting bigger and bigger?
I don't know. That's a good question. Maybe are they getting heavier?
Uh, doesn't seem to be that the case, but this patient, I see that he changing from, black hair to gray hair quickly
Yeah.
after 5 years working with me.
Well,
So,
as you get older, there's more fat cells in your tongue.
yeah.
So I would say that he might benefit from Nightless, which is a photonal laser treatment of the tongue and the palate. And those actually with thermal treatment with an Nd:YAG, you can actually explode those fat cells in the tongue and shrink the tongue size. Okay.
Mm.
You can also firm up the palate and create more collagen in the palate to firm it up. So you can open the airway with Nightless. And also nasal lace. They actually do some nasal lace now,
You
where we
showed
can.
me those. What are you talking about? Those nice lace.
Night lace is a laser that you put in the mouth, and you coat the tongue with a non-cutting laser, and
Mm.
it warms up the fat cells,
Oh my
and
goodness, really? Wow.
then it'll explode them, and then they'll shrink.
So
Okay.
that is would you see like an oral surgeon or
No, you can general dentist. You can even have hygienists do it.
really?
You need to get the training from, I would recommend Harvey Shipman, or you can go up and see Dr. Jeff Skinner in Portland. Jeff Skinner would do a great job for you.
Yes, Skin. How do you spell his last name?
Skinner, Dr. Jeff Skinner. Jeff is spelled with a G,
Mm,
Geoff.
wow. And the laser you mentioned is Nightless.
Nightless, and
Night.
it's done, and you use a photona laser, Photona, photona.
Oh,
You want to get the right laser for this.
yeah. Wow. So with these kind of treatment option, is that the Laser Academy would teach that, or the Sleep Medicine Academy would teach us
I
those?
don't think so.
No.
I think so. No.
So
They might, but I don't think so.
so what are the training academy as institution that we would learn from these things?
Yeah, I don't know if there's an academy that teaches it other than Air Institute, Portland Protocol. That would be the only one that I know of.
Air Institute?
Air Institute, Portland Protocol with Dr. Jeff Skinner.
Mm,
Highly recommend them.
got it.
They're the most brilliant people in the forefront of dental air. And another person up there that works with him, Kimberly Santiago, is really good with MSE. And then Dr. Zelk is there too, that sleep physician I told you about. And
Kimberly
Santiago. Yeah.
San,
She's really, really good with MSE. There are other people that do MSE, and Dr. Juan Moon, he's probably the most well-known MSE teacher.
MSc stand for
Mid-sagittal expansion.
mm,
Mid-sagittal expansion.
Sagittarius.
And Dr. Moon he would be great for learning that.
So MSE then, not MSc, right?
MSE. Yeah,
Wow.
that might help that man for a lot there. Okay.
But it looked like, you got so much to teach and share the world. I really appreciate the
Yeah.
day you
Yeah.
spent an
Thank you.
hour with me. I really
Yeah.
appreciate Dr. Dow, and I look forward to talk to you again.
Yeah.
Really
Well, thank you,
appreciate it.
Locke. I appreciate seeing you again as well.
You have a good day. Stay warm.
All right. Thank you. Bye bye.
Thank you, sir.